Never forget where you come from and always give back. My parents were working class farm workers. I remember they didn't go to the doctor for a long time. Back then they were undocumented themselves. They were really afraid of the government finding out that they're undocumented. So one of their neighbors told them about a community health center that was in our neighborhood. I remember I was like maybe 4 or 5 and being really shocked about being in this really comforting, welcoming space, and people spoke our language. I just remember it being a really positive experience. There was this system to support these families that are really underserved and needy, and that helped my family, so I always felt that it was important to give back to the community. Tiburcio Vasquez's community population is underserved, I would say. We're really the only community health center in this area. We're talking about undocumented Latino families, a huge Afghan population that accesses our services, and Polynesian, Samoan, and Tongan families access the services. So Tiburcio really needs to be aware of how to provide services to this community in a culturally and linguistic manner. One of the services that Tiburcio has identified is really targeting young people. You take Tiburcio and you create a mini version and you place it in a school, and they've developed a school health center. Tiburcio's goal is really to be a one-stop shop for families, so a place where they can access their health care and at the same time they can access the pharmacy. And then providing programs and services that address their ancillary needs. So we may have a yoga group to address stress management. We developed the Promotoras walking group. Every week they walk around the community. They can have their healthcare questions addressed while they're walking, and then at the same time be healthy, connect with the community. The next steps for Tiburcio Vasquez is to improve the patient experience, to make sure that our families feel connected to Tiburcio and the services that we provide. We know that there's 3.1 million individuals that will be uninsured, so we know that there's a need to have more services available for our population, and making sure that it's culturally appropriate, culturally sensitive, and community-centered.